Today we're talking about spider veins, those clusters of blue, red, or purple veins that can make your legs look like a road map of New Jersey. But you know what? I've got good news. You can get rid of them forever. And I'm about to show you how. Bindu, my assistant, is going to help us out. How are you, Bindu?
Great.
So how long have you had your spider veins?
God, I started noticing them in my mid-20s, and it progressively got worse in my late 20s.
Would you mind if I looked at them?
No.
Yeah. So go ahead. So, yeah, I see them. So what do you do to try to cover them up?
I have tried a variety of pastes, ointments, whatever it is, it always rubs off.
Yes. And do they bother you a lot?
Yes.
They do?
It makes me very self-conscious. I feel like I can't express my creativity through clothing.
Right.
It's, pretty much...
That's well said.
handsome.
I like that, Bindu. Your creativity through clothing. Very
That's
good.
right.
All right. Here's what I'm going to do. I'm going to show you how spider veins develop.
Okay.
And then we're actually going to try to help you with that.
Great.
Okay? Here's a quick animation. And this is exactly what's going on in your leg. So let's turn you around. And let's go a little an area just like we did looking at it directly. And inside the body, we've got veins. See the valve up here? The valve is preventing the blood from coming back. But sometimes that valve begins to leak. And as it begins to leak, see it right there leaking? The blood begins to regurgitate back, and that causes the veins to engorge. As those veins engorge, they get larger and larger. They actually release chemicals that make them get even larger and more visible, and then they start to sprout out little branches. That's why you can see even more. They look like spiders, like tentacles coming out, and they have that appearance from the surface of the skin. Now, we appreciate that. They're not dangerous, right? But they bother women a lot. So usually, I give women advice about stockings, and they discount it because they know they're not going to look very attractive. Is that your bias?
Yes.
let me blow your mind. These are new versions of stockings. This is not going to be the treatment for you, but I want you to see them. We have, knee highs and thigh highs and pantyhose over there.
These are actually compression stockings?
These are compression stockings. You want to take some home with you?
Yes, please.
All right, we'll get some after the show. Now, I want you to get rid of those spiders for good.
Okay.
So you don't have to take them home with you, but you can take them home and share them with your friends.
Great.
Okay, this is the newest treatment. Now, before the show, Bindu was introduced to Dr. Heidi Waldorf. She's the director of laser and cosmetic dermatology at Mount Sinai Hospital. Welcome.
Hello.
I want you to lie up here, if you don't mind. Bindu has given Dr. Waldorf permission to inject Asclera medicine into her spider veins and instantly get rid of them. Dr. Waldorf is a consultant for the company that makes Asclera, so she's quite knowledgeable about it. So, Dr. Waldorf, we've talked a little bit about Asclera in the past. What makes this different? Why is this such a breakthrough procedure?
Asclera is different because it's an anesthetic, so it makes the treatment of sclerotherapy not just safe and effective, but also painless.
Okay. So you're going to try it out?
Yes, we're going to do this now.
It's a big needle. I'm going to hide back here. I don't like blood.
That's not helping.
These are very small needles on purpose, as you know. You can watch if you desire. Those look like diamond cutting glasses, Dr. Waldorf.
I use these so I can see the skin better, the better to see you with.
So I'm just going to warn you. I assume you're going to warn her.
Yes, and I will warn her. But quite honestly, she and I have discussed this. This is going to be a tiny little prick, and this really shouldn't be all that uncomfortable. Here we go.
3, 2.
Tiny little stick. Here we go. Do you see the vessel going away? You see that?
Oh, my goodness.
I wish I could see it.
You
Now,
can. That's it right there.
It's right there, and we're pushing the blood
incredible?
out.
That is amazing.
And then I can go to another spot.
But does it hurt?
I've had paper cuts worse.
You're kidding me.
And here we go.
Does
And as a
nothing.
physician, it's very satisfying to treat.
Oh, my goodness. And who shouldn't get this?
Now, this is the ideal treatment for vessels like Bindu's, which are small, less than 3 millimeters in diameter. This is not for someone while they're pregnant or with bad vascular disease.
I mean, I'm stunned.
Really
Honest, what do you guys think? Isn't that pretty incredible? And how much does it cost?
Treatments range from $400 to $700 depending on the number of areas you're treating and who's doing the treatment. Now, most people do need a few treatments depending on the severity of their vessels, but once the vein is gone, it's gone.
Perfect. Now, I have a before and after shot, if you don't mind. I'm going to put it up there just to... I mean, that's a big difference. What do you think, Bindu?
I'm so excited.
You happy?
Very.
Nicely done. Thank you very much.